Hi everyone, my name is Dr. Lila Abbate and I'm a physical therapist, so welcome back to my YouTube channel. Today I'm going to talk about Coccydynia. That's the medical diagnosis. It can be referred to as tailbone pain, sitting pain. You know, in the end, you have painful sitting. That's your problem. So maybe you have come across this YouTube video in order to get some answers. Here's a pelvis, and I'm going to just kind of go through some basic anatomy. Here we have two ilia on either side. This is your lumbar vertebrae, and here's an L5 disc. I'm going to turn this around. Here's your sacrum, and that end tip bone is the one that causes all the problems. This is called your coccyx, and dynia, D-Y-N-I-A, means pain, so we have coccydynia, coccyx pain. So patients have painful sitting, they can't apply pressure, and they feel like anywhere on this tip can be painful. Sometimes some of the problem is patients say, I have coccydynia, but then they're pointing to some other place in their buttock. They're pointing to up here, out here, someplace over here. Coccydynia itself really relates to this one tender bone. If you have ischial tuberosity pain, that's the underside of the pelvis. We call that the sits bones. That could be a different type of sitting pain. There's definitely muscles that attach on the inside. There's your hamstrings that attach on the outside. So then we have to find out why, and as a pelvic floor and an orthopedic physical therapist, that's my job. It's kind of fun because I need to figure out, like almost like a detective wearing a hat, what's the why and why do you have your pain. There are several muscles that attach to the coccyx itself, and then within the pelvis, all these muscles create this sling and attach to different parts of it. So I'm going to get another pelvis to show you some of the muscles. This is the coccyx bone on the bottom. Then you have the muscles here, and those muscles are called coccygeus. So you can imagine if it's too tight, it could pull it to the right, it could pull it to the left, either way. And then if we turn it around, and we look inside the pelvis, you can see that there's big sling muscles that can also pull it forward. So yes, you may have a biomechanical problem where your coccyx is very flexed and it moves into and under your body, but there can be muscles that are pulling on it that create maybe the causation of your problem. So if you've been diagnosed with sitting pain or coccydynia and you haven't found answers for pain relief, you may want to consider finding a pelvic health physical therapist to help you.